Welcome to this roundup. The COVID-19 pandemic has hit nations with many unknown and known risks. While the world is trying to understand the unknowns, much of the familiar known seems also to be getting beyond our control. As a result, both lives and livelihoods, investments and institutions, governments and governance models, business and commerce, manufacturing and supply chains, economic and national security are at risk. So the question then emerges is about our preparedness, our system's preparedness, and our nation's preparedness. To discuss COVID-19 pandemic preparedness further, I'm delighted to welcome Professor Scott Rosenstein to this roundup. Professor Rosenstein is a public health professor and special advisor of global health to Eurasia Group based in the United States. Welcome, Professor Rosenstein. We are honored to have you on this roundup.
Thanks for having me. Great to be here.
Wonderful, Professor. So, while most nations and its governments have responded by declaring a public health emergency and are adopting known measures to prevent the infectivity and limit the viral outbreak, millions of lives have already been significantly altered, and there is no going back. So, as COVID-19 continues to radically transform daily life for anyone, what are your concerns about the state of public health today and in the coming tomorrow?
Well, I think we're learning a lot. I think there's an interesting backstory around pandemic preparedness out of Southeast Asia, which is a number of countries that had experiences in 2003 with SARS and how they're responding in 2020. There are some notable differences between those countries and countries that are becoming aware of the threat of emerging infectious diseases, understanding a lot about what public health preparedness looks like, what pandemics are, and I think that there are a lot of lessons that we can learn from countries that have already been through it. I think, and I'm talking from a perspective of the United States. I think that understanding what the sacrifice needs to be, understanding how infectious diseases are spread, understanding what the connection is between economics and health, understanding how early interventions can have both significant public health but also economic benefits in terms of minimizing the spread, and then also minimizing the need for these broad-based lockdowns, which don't necessarily go over very well in the United States and many countries, and then understanding what that sacrifice looks like in order to move beyond that. So that looks like obviously flatten the curve, which is a term that everybody is now familiar with, but it's more than that. It's bending the curve. While you're bending the curve, you really need to be making the investments in testing, investments in public health infrastructure like contact tracing, and investments in plans to narrow the social distancing as we learn more about the spread. So some of the big questions that we have are, what does transmission look like in schools, right? So when we look into that, then we can make decisions, understand whether school closings are an important part of the equation, or maybe we can bring the schools back, and that brings a lot of young parents who are under tremendous difficulty in terms of childcare, but also maintaining their own livelihoods. That would relieve some of the economic strain on those communities. And then we can, continue to research treatments, research into vaccines, and think about what are the ways to protect the vulnerable populations, which we now know are, elderly, people with underlying conditions, and we can, slowly, incrementally, in an evidence-based fashion, release some of this, difficult broad-based lockdown and exchange it for, more targeted social distancing in ways that, ultimately get us out of this difficult situation. But, that requires, collective action. It requires understanding of the risk, understanding of the spread. And, in the United States, there's not really necessarily a shared understanding or a shared narrative around the severity, around what the best practices are. There's still a lot of, there's the politicization of mask wearing. Some people are against mask wearing on human rights grounds, and then other people are uncomfortable with people that aren't wearing masks, and that turns into a proxy for a political, a political ideological battle, which is not good for outbreaks in any way. There should be a sort of a commitment by the community as a whole to get through it together. And right now, we're not seeing that, as much as we could be in the United States.
Sure, no, I hear your point, but my understanding on the pandemic is very different, and that is based on my training as a scientist. And what I see is that pandemic is a portal to evolution. The way our species has evolved is because of these viral infections that we have been getting over the years. If we look at our human genome, almost half of that is made of, the virus DNA. So every time the virus infection happens, the virus invasion happens, if we, want to talk from the perspective of a war, then, that when you get into our DNA, it leaves behind, certain segments of its, genome. So that carries forward, in future generations if it gets into, certain cells. And then that's how, evolution has happened. And that's how we see many races, different races have different immunity, different, challenges in, facing certain health vulnerabilities. Not all of us, if many of us stand in one room and if somebody is infected, then not all of us get infected because of that. Some of us have resistance, some of us are much stronger than others. So there are many different roles from a scientific perspective. But what you said about that we don't have the same collective risk understanding, I think you are absolutely right about that. None of us are understanding the risk today, and and managing risk is not taken very seriously. Risk management and planning should go hand in hand. We risk professionals, we understand that quite clearly, but understanding of risk, identifying it in a timely manner, communicating that we are not seeing that, because the risk management, the discipline is not taken very seriously. So that's where we have the challenge. But when we look at how you gave examples of the SARS and other pandemics or epidemics rather, we have witnessed in the last few years. But if we see the way we are managing this pandemic is pretty much like the Spanish flu, the physical distancing and all these, why every country out of fear shut down their economies. That itself shows that we have not evolved in how we can manage these kind of outbreak. And especially when we look at the advances that we have made in science and technology. So pandemics, we all know that they don't occur every year. However, planning and preparing for a pandemic is important to ensure effective response. So while public health officials and healthcare professionals and scientists, everybody, they are trying to work together and prepare for any possible pandemic that can happen in the coming years. Do you think that our nations were prepared or are prepared for COVID-19 pandemic, not just United States, but looking at every other country? Do you see that there was any level of preparedness?
Well, it's an interesting question. I think there are a number of sort of general assumptions about pandemics from the pandemic preparedness community. One of those is that no country will perform perfectly. There are challenges that the virus poses that will be almost impossible for a country, no matter how prepared they are, to perfectly prepare for. That said, there's lots you can do. In the pandemic preparedness community, there has been for a long time, particularly after SARS, but even before then, there was this recognition of, you hear it a lot, it's not a matter of if, it's a matter of when. We know what the general phenomenon is, or the general dynamics are of animals intermingling with humans and viruses, it being introduced into the human populations that humans have no previous exposure to, and the risks that they pose. We're familiar with that. We saw it in SARS, we've seen it with MERS, we've seen it with new flu strains, we saw it with Zika, we've seen it with Ebola, in Africa, and so there's, from the pandemic preparedness perspective, there's sort of two different buckets that I like to say that that we look at in terms of risk management. There's the stop it there before it gets here approach, which is monitoring and surveillance, understanding sort of how humans are encroaching on different ecosystems, and what the risks are for viruses from wild animals and farm animals, what the risks are for those types of viruses to make a jump to humans and then cause this type of outbreak. That's very difficult research. There are viruses probably in the tens of millions, hundreds of millions in animals that are mutating and moving around all the time. The overwhelming majority of them are harmless to humans. Either they're not transmissible, or they're not severe. They're not deadly. They don't really cause any harm. But every now and then something happens. A virus mutates in some way. It recombines with another virus, and it becomes both transmissible and lethal, or severe, and it causes severe illness. And we have, there's been a number of efforts at the international level to try to surveil that, to try to kind of get out in front of whatever this process is that ultimately introduces these new viruses. And there has been progress. Our ability to understand the human genome and viruses very quickly in 2020 is very different than even it was in 2009 for H1N1 or 2003. And so we have made progress there. This is not a surprise to the pandemic preparedness community. Unfortunately, in a number of countries, the prioritization has not necessarily really persisted since SARS, since 2003. And so we've seen a number of challenges. We've seen challenges in the US, which I can speak to more personally, but challenges around maintaining the stockpiles, understanding hospital surge, understanding, just having the basic local and state public health capacity. So that's very traditional shoe leather epidemiology, we call it. It's just testing and contact tracing. Someone is sick, we tell them to isolate, we contact trace everyone they've been in contact with. Those people, we ask them to quarantine, and that is how you get out in front of an outbreak. In the United States and in many countries, whether rich or poor, there was a lot of delay, there was a lot of debate, there were questions around leadership, questions around messaging. How do we get the right message out? How do we keep it from getting overwhelmed by misinformation or bad actors or opportunists? And all of those things slowed us down. Some countries did respond very quickly, from Vietnam to Taiwan to Australia, New Zealand, Germany, Iceland. Those countries that took this sort of public health response early and stuck to a sort of evidence-based approach that seeks to balance, create a balance between panic and complacency. Those countries are in a better position now, and will hopefully be able to respond to smaller spikes in cases in a more targeted manner. And that is not where we're at in the United States. It's not where Brazil is at right now. I think there's a lot of questions about the outbreak in Brazil. Latin America more generally, I think, is really in a difficult spot right now. The trajectory is very concerning. The ability to maintain long-standing lockdowns is very low, and the cases are mounting. And we're seeing that really kind of create its own new challenges in a different continent. So there's different challenges that the challenges that countries face are very context specific, and now we're really kind of confronting what that looks like in Latin America and possibly other continents moving forward.
Sure. I mean, I hear your point, and I think time will tell us, short term, long term, who benefited from the approach that they took in how to manage this pandemic, which countries benefited and which countries lost. I mean, it's very likely that what we feel today, that these countries, because they were quite ahead in contact tracing, that they were able to prevent this further spread of the virus. Now it's very likely that the countries where it spreaded more, like in United States and Brazil and other countries, that we may develop, we may end up getting certain traits that would put us ahead of, many other countries, from an evolutionary perspective. So that is something that we are not going to know today, but it's a very unique scientific puzzle that we have to look at, that what traits are we going to get from this virus from an evolutionary perspective. So even if we are suffering right now, 100 years from now, if we end up getting, let's say, resistance to electromagnetic spectrum, that we are more EM resistant, then that would be worth going through all this, because we want to develop those kind of resistance if we want to go on our universal journey, because we not all planets have these Earth-like conditions. So there are a lot of interesting curiosity that is emerging from this. But the point that you made about that the virus, the jump from animals to humans, that is something that we need to investigate further, because the question is, why did it jump? What changed in our human ecosystem, in our environment, that made it conducive, that made it favorable environment for the virus to jump from the animals to humans? That is something that we do need to understand, because if there are some gaps, vulnerabilities emerging, weaknesses emerging in our environment, that is impacting human body, that is impacting human metabolism and physiology at cellular level. That is something we do need to understand. Otherwise, this is not the only pandemic. We will probably get many more pandemics in the coming years. So these are bigger questions that we do, scientific community, need to solve. But to understand the effectiveness of medical care, it is important to understand healthcare and human health, because all these are tied. So how are we understanding human health? What determines human health, and who is responsible for it, are the questions that we need to understand. Because what we see human health, or what we see healthcare right now, rather I should say, is more like a disease care. So yes, we have all these fancy hospitals, highly equipped with all these technologies. Are we actually doing anything for the betterment of the health of anybody, any race, any community? Because I don't think we are doing that. If we were doing that, not so many people would be getting so sick. So what is your understanding? Is our healthcare effective? Is it something that we should be focusing on for having a better preparedness for coming tomorrow?
Yeah. Well, I think it's an important question. So, my background is public health. I am not a doctor. I think the discipline of public health is very interested in a lot of the questions you're asking there. The discipline of healthcare is essentially a subcategory of public health, broadly speaking. So public health really does look at a lot of these things. What are the determinants of health? What are the impacts of certain behaviors? What are the impacts of socioeconomic differences? Exposure to different environmental health risks, exposure to different things like transportation, access to communication, trust in government, ability to advocate for one's own kind of betterment of their health, and then also the role of humans in the broader environment, in the broader ecosystem, in terms of pandemic preparedness and the emergence of new infectious disease. We don't fully know exactly how this COVID-19 emerged, but we do know that viruses like this are mutating all the time in animals, and when humans encroach on those ecosystems, so this includes sort of development onto existing ecosystems, it includes the sale of wild animals, it includes factory farming, where you're putting lots of animals in very close quarters, and other humans are interacting with those animals that are in very close quarters. So there's so many different drivers that are not retreating, they are increasing. So our human behavior in terms of 2009 H1N1, the best guess is that it emerged in a factory farm in North Carolina. SARS emerged in southern China. The Spanish flu, so-called Spanish flu, it first started spreading far and wide in a military barracks in Kansas. And so there are all of these human behaviors that ultimately create a kind of an ideal setting for viruses to evolve, to find new hosts, to become more efficient at transmitting and replicating. And those are, and our scientific understanding is improving, but our behavioral response continues to get more risky. And that includes even just international travel. So 1918, the Spanish flu circumnavigated the globe about 3 times over the course of 18 months, let's say. In 2020, it happens in about 48 hours. Because of how much humans are moving around the world, 1918, there was no air travel. In 2020, there's plenty of air travel, not right now, but there normally it's an incredibly efficient way for viruses to spread globally. And we haven't really created the systems in place to identify them, to think about ways in which human behavior more generally can be more resilient or more responsive to this well-known biological phenomenon. And we have to not just rely on some type of healthcare intervention. Technology will not save us from COVID-19 tomorrow. There is a chance that a vaccine will be very important at some point in the next, say, 3 to 18 months. But that's no guarantee. There's still a lot of questions around how this virus behaves in terms of immunity, how long lasting it is, how many people, how much protection it provides, and then also what the role of vaccines would be under that type of immunity environment. So if we do, we know a little bit about coronaviruses. We know that the common cold coronavirus does not provide lifelong immunity. It usually provides some type of immunity that may be a year, maybe a couple of years, but it starts to fade over time. So then we have to really think about what the near future looks like of, say, vaccinating the whole world or vaccinating a very large percentage of the world. That's develop, manufacture, and distribute billions of doses of a vaccine that's never been injected into humans before. And then think about what comes after that. What happens if the immunity that vaccine provides isn't long lasting? And then then you have a situation where perhaps we retreat into a situation that's similar to seasonal flu, where you have to continuously get vaccinated. That's not ideal. Seasonal flu still kills many people a year. Pandemic flu still exists as a very significant threat that we haven't really kind of gotten out in front of yet. And then there's the possibility that this challenge, this incredibly difficult crisis, will take our eyes off the ball for whatever the next challenge is, and we'll do what commonly referred to as planning for the last disaster. And that is a really, that is a persistent part of modern life, is that there are a number of different challenges on the horizon. Some of them are uncertain, some of them we know about, but all of them require a much more systemic approach to getting out in front of them, not making this into a sort of a falling back into some type of technological solution mindset where modern medicine will solve it, and we don't really have to worry about our behavior, worry about the sort of the natural dynamics of the physical world that are still creating the environment for these types of threats to continue to emerge now into the future, and then also could make us more vulnerable to additional types of threats that we don't even know about yet.
Sure, of course, human responsibility and accountability needs to be at the core of our decision-making process. Especially, we are not talking about independent risk. When it comes to interconnected, interdependent risk, all of us needs to be accountable. So this pandemic fits into that category. It's a interconnected, interdependent, integrated risk. So we cannot. Every one of us needs to be responsible, because any weakness in our human chain is going to create complex challenges, and it will create further spread of the pandemic. But talking about what role technology has, or whether technology will be able to prevent any further any future pandemic, I firmly believe that we can make this our very last pandemic. Now, the question is whether we want to make this our very last pandemic. Because if you look at all the advances we have made, from AI to Internet of Things to biosensor technology, it is not difficult to create a system and implement that all over the world in a way that any outbreak will immediately give us an alert, timely alert. We are not talking about alert kind that we got from World Health Organization. We are talking about timely alert in real time, and if we get those kind of alert, we will immediately be able to stop the spread of the virus. But the question is, it's not just virus, any bacteria or any other microorganism, but the question is, do we want that? So that is something collectively as a society we need to come to terms with, that do we really want to put pandemics behind us? Because if we want to, it is definitely most certainly possible to do that. But that there needs to be a will for that, because then it comes about politics, and the politics of investment and politics of industries and all that. We don't want to discuss on this discount because that's a topic of another discussion. But if we want to do that, we can make this our very last pandemic. Now, talking about the vaccines, sure, vaccines, we have come a long way, and a lot of advances are happening. The rapid way we were able to come up with new ways of creating vaccine this time for this particular virus is quite uh, amazing in a way, if you put at it, simply, there are so many vaccine trials going on, and a lot of them are very interesting, so I look forward to seeing those results. But if we when we look at this, the broader challenge is facing us as a society, so we need to define what problems we never want and what problems we can live with. So based on that, we can come up with effective intelligence, effective brainstorming, and we can definitely solve all those problems. We have enough brain power in this world to be able to put complex challenges behind us, but there needs to be a will for that. So if you look at this pandemic, it's attacking the society at its very core, and nations are facing this crisis unlike anything they have faced in the last century. So we have been witnessing and reading the news that it has killed many many people, hundreds of thousands, and it has spreaded so much human suffering. And it's still, there is no certainty that it's stopping here. While it looks like we are getting a pause right now, but it is not going away. It may come back in the second wave. So there are many implications for this: health implications, economic implications, but most important is the societal implications. What do you see happening in our society? What kind of societal risk and societal crisis you see emerging based on the way we have handled this pandemic so far, and what needs to change?
Well, I think some of the more sort of structural challenges, or some of the structural issues that we're seeing now around access to critical goods, around the just-in-time supply chain, I think that will be really reassessed. I think there will be a lot of efforts to bring manufacturing back home around some of these critical goods, to build up our own domestic vaccine manufacturing capacity, our own capacity to build, to create, to manufacture PPE, face masks, gloves, gowns. All of those things will become tied up into probably a larger national security argument in terms of those types of investments. And then also more generally, I think globalization as a system is really kind of under strain right now. There are a lot of political movements that find globalization to be a net negative for their communities, and those arguments are ascendant right now. There is a lot of skepticism around globalization that really might change our own access to goods, our relationship to other countries, our diplomatic relationship, our economic relationship, and that I think is a fairly short-term discussion. Well, let's say perhaps a challenge, a confrontation that will happen in the aftermath. I think some of the other things that might happen is our relationship with healthcare will possibly change. It might, in fact, move to, let's say, more telemedicine. There may be a more appreciation for technology as a way to minimize spread, make healthcare more efficient, make put us in a position where if we are kind of faced with this type of threat again, we will have more tools. We will be able to transition to a more protective posture quicker. Telemedicine is an excellent example of that. But then there are also, there's also just a lot of, the debate that was really brewing before the coronavirus pandemic was around privacy and data. And there was a lot of concern around the role of, big data in our private lives. And I think that will still be a big concern. I think there are a lot of people that are very, that question the role, the question the risks around handing over so much of their data. At the same time, there are obviously benefits to having access to large data sets that can be deployed during emergencies. And you're seeing this now in a number of countries that are rolling out these digital contact tracing apps that are able to identify individuals' contacts, identify what their risk might be for transmission, let them know if they've been in contact with other people who've been infected. And that's going to be a really big discussion. I think it will not be the same around the world. I think that there will be pushback in a number of probably Western European countries and the United States around this question of privacy. In places like South Korea, there has been much more of an embrace. Singapore, there has been an embrace of these approaches. And I would still say even in those countries, it's not exactly complete embrace. There is still concern, but there is more willingness, I think, to engage in some of this more type of 21st century epidemiological approaches than there are perhaps in the United States. I think time will tell. Some of that has to do with the urgency, the risk. It has to do with the way that this conversation takes shape over time, and who's out there in front, who's out in front shaping this conversation. How do we communicate the risks and the benefits of kind of participating more in some type of data sharing infrastructure? And I personally don't know where I stand on that. I know that I appreciate both the risks and the promise of things like digital contact tracing and data aggregation and machine learning. All of those things are obviously potentially incredibly beneficial to humanity. But at the same time, it doesn't take much sort of science fiction speculation around how that can be used by bad actors, how it can kind of undermine the social fabric, of communities instead of build it. And all of those, I think we are entering into an era where those questions will really be front and center. And I think the resolution or the ultimate final kind of landing place, our society's end at, or kind of where we land on this issue, I think is still very uncertain.
I hear your points and your hesitation in taking, in deciding, where you stand on this, because these are very complex questions and we need to be very thoughtful about, where we go as a society. And the point you made about the globalization, I think globalization in the current format is almost as good as dead. It is not going to survive. And it's not just because of COVID-19 that we saw the vulnerabilities in the supply chain and how we may face much bigger challenges because of the broken supply chain, especially in the food industry, and agriculture. And we all witnessed, how difficult it was to even get the face mask and personally protective equipment. So this form of globalization is not going to survive. Every country will need to be self-sufficient in basic needs that they need for survival and security for their country. So we will have to think really hard how we can all work together. Every country can work together, but this form of globalization cannot survive. And the point that you made about the privacy, I think privacy that we were used to over the years, that definition and the nature has absolutely changed. We cannot expect the same level of privacy that we had over the years because of the digital age. The cyberspace has completely fundamentally changed that. But when it comes to contact tracing application, I think I have no hesitation in saying that it's an overreach. And the reason I'm saying that is because if you look at what promise they are trying to sell the technology companies, I am a very strong supporter of technology, but here the benefits, I don't see that. They want to, make sure that, if we know who, came in contact with who, then, we can prevent the further spread. But I think there is a huge overlay. These are virus particles. Even if you don't touch someone, even if you don't talk to someone, by just being in that environment, that virus can be in the air. It can stay there for hours. If anybody else passes through, even if people you don't talk to, you don't know, it may or may not infect them. So the whole premise of that, we will be able to control the spread of the virus based on, knowing who, people come in contact with. I think fundamentally we all believe in autonomy. This is not even about privacy or, data security. This is about our fundamental rights of autonomy, freedom in deciding what we want to do, where we want to do, who we want to talk to, where we want to go. We don't want that the global surveillance on that, or, technological surveillance about our, whereabouts, who we talk to, who we don't talk to. That should not be allowed, because the fundamental freedom, what I want to eat, how I want to treat my body, how I want to, you know take care of my health, wellness, who I want, who I meet, who I associate with, that is nobody's business but mine. And if we allow others to, create that surveillance network in the name of COVID-19, then I think, we are as a society going to suffer, significantly. And I would definitely not support that. So these are some big questions we all have to be very, very cautious about, because this is not just about, the viral infection. This is about our fundamental freedom, our fundamental rights to autonomy. So that is just, what I think. Now, when we talk about the COVID-19 and the role we all have to play, not just the governments, not just the healthcare industry, but we as individuals, what is our role, in this interconnected, interdependent system? So that is something we have to, start evaluating, very seriously, because what, just depending on governments, just depending on World Health Organization, just depending on the hospitals and doctors, are we able to, take care of our problems, these significant problems in the coming years? I think uh, that's where I have, I think we need to focus on. Do you think that just depending on governments or World Health Organization or any of these systems that we have put in place, is that enough for us to, manage our, critical security risk in the terms of, infectious disease coming our way? Or should we create a citizen force to assist us in reporting disease outbreak in a timely manner?
So I think broadly speaking, in general, all disasters are local, in that at a certain point you cannot depend on federal government, international health organizations. I think it is about community. It's about working together with your neighborhood, particularly in sort of severe acute emergencies. That includes things like floods and earthquakes and hurricanes. Pandemics are a little different in that they unfold over a longer period of time, but they're also similar in that there is an expectation that local communities will be on the front lines of really kind of mounting a response. That can be the local public health agency, community health workers, individuals, neighborhood groups, and these things tend to become localized very quickly. So in that sense, I think there should be no expectation of some large either company or government or UN organization being sufficient to help us respond to whatever the next challenges that we face. I think that more broadly, there is the role of individuals in educating themselves and understanding what their responsibility is. I think in turn, this has been a crash course in public health for many people. This is something that I spend a lot of time thinking about, but I'm also now talking to people that are much more knowledgeable on some of the fundamental core concepts of public health, and the role of that type of preventive or proactive effort to address some of these challenges, whereas to your question earlier, healthcare tends to be reactive. Public health is really about being proactive and addressing some of the root causes. Some of the root causes right now include deep, deep polarization, political polarization, right? The fact that nobody can even agree in the United States around what's happening or on how severe it is. It is tearing us apart, both sort of socially, but also from a health perspective, because we're unable to really mount a coordinated response. And that is a local, state, and federal response that is required. And so all of these things get back to, I think, your earlier point about the interconnectedness. Obviously, every neighborhood group behaving on their own would also be a challenge, because anything that you do could be undermined by the next neighborhood over. So there needs to be coordination and cooperation, but there can't be an expectation of some type of supranational or large entity that will provide the necessary resources to all people equally, because there will be a shortage. There is a shortage. The nature of a lot of these challenges will persist after coronavirus. There won't be necessarily, there may be a sort of a effort to build more redundancy into the system. There won't be enough redundancy to respond to whatever the next challenge is in terms of whatever the supplies that are in whatever's in short supply, whatever type of new understanding and messaging and communication outreach is necessary. All of those things will be once again stressed. It may be an infectious disease. It may be something related to climate change or social unrest or cyber terrorism, or all of these issues are certainly potential challenges that we're understanding now we are so vulnerable to. And I think that's sort of the headspace that I think a lot of people will need to kind of move to, is that it may not be a coronavirus pandemic next time, but a lot of the stress on the system will be there. And that is the type of thinking that we need, is the type of honesty and transparency from our leaders that we need to really get out in front of this conversation, recognizing that no one's going to be perfect. There will be challenges that will that will create damage, will create loss of life. But the mitigation of that, minimizing those toll, is possible through a very kind of concerted, evidence-based approach that doesn't allow itself to get kind of short-circuited by bad actors, politicians, opportunists, all of these things that we're seeing now that are really undermining the response in the US, but also other countries.
Sure, I understand. So you are very passionate about public health. You're very passionate about risk and resilience and politics. So you just summarize quite a bit about what you would like to see. But what would you like to tell our global viewers and listeners, especially the young, brilliant minds who are trying to enter this field of public health, as they see the impact that this pandemic has created on the society and how it has pretty much collapsed all the systems. So a lot of young people are very curious, are very eager to make a difference, to bring the positive changes in our systems and society. So what would you like to tell them?
I think that's a good question. That you asked a question that's very near and dear to my heart, because it's something that I grapple with every day. And really the short answer is a respect and a humility around uncertainty, right? We have a sort of an epidemic of hyper certainty out there. We have an epidemic of oversimplification of what we call armchair epidemiology, the act of thinking that you understand the incredibly complex nature of this challenge is itself a liability. Being humble to just how complex it is, being humble to just how uncertain this environment is, but how a evidence-based approach that is iterative, it's not about panic, it's not about blame, it's not about complacency, it's about here's what we know, having that information, recognizing that it's imperfect information, what's the best path forward. When we make that decision, can we course correct if new information becomes available? I think that mindset is in short supply, I think, in general with the adults. I think many of the youth today are witnessing that. I think, people who are not necessarily in a decision-making position are witnessing this epidemic of hyper certainty, and of, incredible reluctance to be transparent about how much we don't know and how much we really need to um, build an evidence base around our decision making and understand that that won't be perfect, but but that will be the best approach to minimizing the damage. And the opposite scenario where we have people who don't accept their shortcomings, they don't accept the mistakes, they double down on mistakes, they hide behind ideology or political parties. That those people, those types of systems will ultimately, I think, I'm hopeful, be reconsidered after all of this is done, because that is really what is, what is at the core of some of our challenge right now, and really kind of getting a shared understanding of what's happening, creating a kind of a unified approach, a humble approach, a way of communicating that humility to audiences that brings them in, brings them into the tent, doesn't create a sort of antagonistic relationship, doesn't create a, false authority or an overly simplified narrative, that when that narrative falls apart, the credibility of the messenger also falls apart. And if we can kind of create an environment where in the future that conversation can be had in a more measured way, in a more thoughtful way, in a more equitable way, an inclusive way, bringing people in and not kind of making it a contest or confrontational, I think that would be an incredible torch to hand over to the next generation.
No, that is a good, excellent advice, I would say, for to keep in mind about being open-minded, being humble, and focus on the efforts on evidence-based medicine, evidence-based approach, and not get bogged down by the ideology, because managing risk is above any ideology. So we should be very, very focused on the objectivity of our analysis, because that's what our job is. If we want to bring very effective solutions, then we want to make sure that we stay objective in our approach. We cannot be partisan. And that is something we all professionals have to keep in mind. So thank you so much, Professor Rosenstein, for participating in this roundup today. We appreciate your thoughtful insight on pandemic preparedness, and our global viewers and listeners will benefit tremendously from the information you shared today. And even if a single individual, organization, or nation is able to understand how to better prepare for pandemics after listening to this discussion, this risk roundup dialogue has been of service, and we thank you for that.
Thanks for having me. It's been great.
Wonderful. Thank you so much. So Risk Group is a strategic security risk research platform and community, and our ecosystem is the first and only cross-disciplinary and collective community that is made of top scientists, security professionals, thought leaders, entrepreneurs, philanthropists, policymakers, and academic institutions from across nations, collaborating to research, review, rate, and report strategic security risk to protect the future of humanity. Add your voice to risk groups. Get involved to protect the future of humanity. Thank you.